Ladies and gentlemen, every day millions of people walk into a pharmacy not with a prescription, but with a symptoms and question. I have a headache, I have a cough, I have a fever, and what medicine should I take? This is a self-medication, and it is now a central part of modern health systems. Globally, around 67% of people have practiced self-medication at least once. Community pharmacies have quietly become the front line of primary care and triage. World Health Organization actually supports responsible self-care as a way to strengthen systems, but there is a serious risk. When self-medication is not properly assessed, it can become a patient safety problem. Medication errors are not only a hospital issue, they occur every day in outpatient and community settings. Some estimates suggest medicine contribute about 1 in 131 deaths in outpatient. Many of these actually are preventable. Take acetaminophen, for example. In the United States, overdose of acetaminophen can cause about 56,000 emergency visits, 2,600 hospitalizations, and 500 deaths every year. And it is a leading cause of acute liver failure. About half of these overdoses are intentional. Patients simply don't realize they are combining multiple products containing the same active ingredients. This is not because pharmacy lacks of knowledge. It is because they face high workload, interruption, limited staff, and very short counseling time. Protocols like WWHAM does exist, but in real practice, they are not applied 100% of the time. This is where SIGAP, Smart Interactive Guidance for Assessment and Pharmacy Support Decision, comes in. SIGAP is a digital triage kiosk in pharmacy, a touchscreen system that the patient uses before they meet the pharmacist. It is designed to support, not replace the pharmacy. So how it works? First, registration. The patient enters basic data such as name, age, sex, allergies. Second, guided symptom assessment. The kiosk guides them through standardized questions based on protocols like WWHAM. The questions such as what are the symptoms, how long have they lasted, do you have any medicines that are you taking right now. Third, rule-based clinical decision support system. A rule engine processes the answers using clear if-then rules. If headache long lasts about 3 days and with high fever, the system will refer it to doctor. If red flags like extreme age, severe symptoms, or long duration appear, the system will automatic referral. And if low risk, the system will give suggestions, safe self-medication with over-the-counter options and dosing. Fourth, pharmacist verification. The pharmacist receives a summary of symptoms, risk factor, and system suggestions, and then reviews and approves or adjusts the plan. Fifth, counseling and record. The pharmacist focuses on counseling, not repetitive questioning. All interactions are stored, building a medication history for future visit. So how does SIGAP connect to SDGs 3? SDGs 3.8, Universal Health Coverage. It is not enough to provide access to medicine. They must be safe and appropriate. SIGAP helps ensure that over-the-counter medicines are used based on structured assessment and documented decision, not quick guesses under the pressure. By catching red flag symptoms early and preventing inappropriate over-the-counter use, SIGAP can help reduce avoidable hospitalizations and serious adverse drug reaction. SIGAP makes community pharmacies part of a digitally enabled, data-driven primary care network and not just point of sale. This is exactly the kind of innovation countries need to advance SDGs 3. With Every time a patient walks into a pharmacy and asks, what should I take? We have an opportunity or a risk. With SIGAP, we turn that moment into a safe, standardized, and empowering interaction that supports pharmacies, protects patients, and brings us closer to SDGs 3. Good health and well-being for all. Thank you.